Hello po and good morning. Matagal po kaming nawala and we're happy to be back with you. We were busy po because as you know, I own po a flower shop and one of the largest floral businesses po in the Philippines. Um, I sell po wholesale flowers under K Flowers Manila. Pakilagay lang po, K Flowers Manila. And we have an online retail named Anna York. Yes, nakapangalan po sa akin. So my name is Dr. Anna York Bondok. I am a pulmonary specialist po and an internist, internal medicine. And ako po ay isang mommy na nakabase po dito sa San Juan, San Luis, Pampanga. I'm also the wife po of Mayor Jason Sago. Ayan po, nakalagay, K Flowers. That's the wholesale name po. And our retail name po is Anna York. So today we'll do a quick Ask Dr. Anna po kasi ang dami po talagang lumalabas na mga issues. COVID and non-COVID and marami po talagang lectures that we're reading but nobody's answering questions. So yan po, that's the business, Anna York Flowers. So nobody's answering questions. So today, siguro po nag-build up na rin po yung mga tanong natin because of the time na hindi po tayo nakapag-live. Pagpaumanhin nyo na po, today we will do Ask Dr. Anna. And tomorrow po, we will do the medical word of the day, which is the complete blood count or CBC. So guys, ready na po ba kayo sa mga tanong? I think some of the questions were already placed po dun sa poster. So let's project them. Miss Reina, Miss Kat, let's have our first question po. Meanwhile, sa mga iba who missed us, um, please put your questions below. Again, Miss Kat is asking lang po a few minutes. So kwentuhan po muna tayo. We do have a YouTube channel. The name is Dr. Anna York Bondok. Please like and subscribe po yung aming YouTube. Doon po namin linalagay yung mga replays po ng amin pong mga videos. We have more than 200 videos. I'm really shocked na nagawa po namin to. And we hope that you like the topics po. Forthcoming po, na postpone din po si diabetic retinopathy. What is diabetic retinopathy? Ito po yung diabetes. Bakit po nabubulag ang mga tao pong may diabetes? And that was a headline po by ophthalmologist and retina specialist Dr. Nicolo Agustin. Kaya lang po si Doc Nico natawag po sa OR, so na-postpone. So ang dami na-postpone this month, guys. I'm sorry talaga. But babawi po tayo dito. So, Miss Kat, are we now ready? Kahit one question lang. And let me read na lang po yung mga questions po na nasa baba. Okay?
Doc, ito na po from Miss Zari Zarin. Ano po ang normal?
Zari? Good morning, Zari, and thank you. You have the first question. The floor
ano
is
po
yours.
From Miss Zari Laring, ano po ang normal CBC levels?
Ma'am Zari, we will be talking about this tomorrow, but I'll just give you na lang po parang just a backgrounder po sa topic po natin na CBC. First of all, what is CBC? Napili ko po yung CBC kasi ang daming C cancer, chemotherapy, COVID, ang dami no? So, napili po, meron pang cervical cancer, diba? Ang laking issue yon. Very big. Vitamin C is another issue po na talagang pwede ho natin pag-usapan for the letter C. But na-intriga po ako because somebody placed na I want you to discuss the CBC, Doktora, because it is so basic. Kasama po yan sa yearly exam po ng mga empleyado, yearly exam po ng mga teachers, yearly and annual physical exam po ng nagpapa-executive check-up po sa ospital. And the moment po, meron kang, the first blood work talaga po na gagawin ng isang doktor is really the CBC. So talagang napaka-basic talaga niya, but a lot of us do not understand why we are required to do a CBC. In fact, I would venture to say po na siguro 95% ng Pilipino, kung kayo po ay na-ospital, na-operahan, nanganak, nagkasakit, na ER, whatever, na CBC na po kayo. So I invite everyone tomorrow. Please, you can post your CBC, and then I'll try and interpret a few of them. But please don't put your name kasi bawal po yun, okay? May privacy po tayo. So you can put the line on the name and then put your CBC. Pipili po kami ng 5 or mga 3 or something like that po para ma-interpret. So CBC means, Ma'am Zari, complete blood count. And it's very important po kasi we will study po, ito po yung malalaman po natin sa CBC, our hemoglobin or yung tinatawag po nating RBCs, yung ating white blood cell count or WBCs. Lalabas din po yung differential count doon, which is the number po of WBCs and the kinds. And number 4 po, lalabas din po ang ating pong platelets, which is used for clotting. So yun po yung 4 main. Doon po sa RBCs, malalaman po natin yung shape, yung size, yung itsura. Kasi po, they will be, for those who are medtechs, tinitingnan po ito under the microscope. Excuse me. So very interesting po talaga ang ating CBC. I will go through the normal levels. So malalaman po natin, for example, your RBC or your hemoglobin, too high or too low, pag-uusapan din po natin. Yung ating pong WBCs, white blood cells, too high or too low, let's talk about that tomorrow. And then, may normal count din po ng mga differential. The differentials are the kinds of WBCs that we see from the matured, iba't ibang kind. So, pupuntahan po natin yan. And the platelets. How do we count platelets? So, malalaman po natin lahat yan. It's very, very interesting. Very, very basic po. Very, very necessary. But sometimes, I think siguro ho, dun sa 95% po na nagkaroon ng CBC, maybe 94.9% do not truly understand why we need a CBC. Okay? And actually po, this CBC topic is so broad. Pwede po nating, just the hemoglobin alone, 3 araw na in an entire conference po yan. That entails cancers, kidney disease, lahat po, infections, ang dami. The WBC alone is another whole 3 days po yan. The platelets, another whole issue. Kasi that includes the study po of leukemia, multiple myeloma, the blood cancers, ang dami. So, siguro wag po natin masyadong laliman. Let's just go through the broad CBC. And then we can do segments on each one of them later kasi matindi po talaga. And it's something that we need to know para pag sinabing, pa-CBC ka, alam mo kung bakit. So Ma'am Zari, tomorrow po we'll do an entire talk on that, okay? But thank you for joining us today. And alam ko pong marami po kayong magagandang maitatanong pa. Thank you so much po, Ma'am Zari. Ma'am Reyna, ikaw, I'm sure you've helped a lot of med techs, di ba? Sa umaga, when you wake up, CBC ka agad yan sa ospital o ano?
Yeah, true po. At saka, importante kasi talaga yung CBC. Tinatawag namin siyang baseline records for you to detect or determine kung anong wrong sa sarili mo. Almost all doctors,
yan ang una.
Yes, opo. Para ma-internalize nila kung ano ba talaga yung nangyayari sa'yo. Kasi they cannot just, halimbawa, for me to explain lang as a nurse, tinatanong kami lagi talaga ng doktor, pina-CBC mo na ba yan? And then, pagka sinagot namin no, ay hindi natin malalaman kung ano yung wrong. Kasi what we see from the patient is very subjective and sometimes magiging objective ka lang as a practitioner, pero you have to have
you have to see the numbers.
Yes, you have to have a baseline data which are facts. Kasi 'di ba, sasabihin sa iyo ng patient, masakit talaga pero sasabihin ng doctor pag pinalpitate niya or pag hinawakan niya, wala naman po akong nakakapa. Hindi masakit talaga, sasabihin ng patient. So, para magkaroon ng referee, we do a CBC test. That's what we do. Okay, masakit pala talaga. Oo nga pala, meron kang inflammation. So, makikita yun lahat sa CBC kung may inflammation, kung meron kang bacteria or virus, yun. Doon yun makikita. Yun po.
Actually, yes, it's really the starting point of every blood test. Pero if I swear to you, Reyna, if you ask every patient who was nakapila doon sa lab for the CBC, hindi nila alam. Hindi naman sinasabi ng doktor sinasabi ng doktor, hoy, magpa-CBC ka. And then writes in the prescription, CBC. After that, what? What is CBC? Do you know? And then you get this bunch of numbers and nervous ka na lang, you're just praying and hoping. You have the question of Ma'am Zari, what is normal? But again, you know what? kahit abnormal yon, sometimes abnormal can be not scary. You just have to know why. And we don't know why. Yun. So
That's
maybe a
true,
short
Doktora.
explanation, yeah. And please post your CBC. Don't put your name, ha? Kasi bawal. But I'll try to interpret a few of your CBCs para ano lang. Para lang may
Yes.
mapag-usapan po tayo. But again, this is not, this is, baka magpa-CBC lahat ng tao mamayang hapon. This is not, this is not, how do I put this? Hindi po siya personal na consultation, ha, for learning process lang. Kasi, I would like to say, kahit may CBC ka, we do not interpret numbers alone. We interpret what is the patient's condition, bakit ho pumunta yung pasyente, followed by the blood test. Hindi po blood test lang and then sasabihin ko na sa'yo yung problema mo. Hindi. Everything starts from the history and the physical exam, and then we add the testing to help us confirm kung ano yung iniisip po namin having heard your history and physical exam. So I invite you to put your CBCs there. But again, please this is not an automatic consultation for you. Kailangan nyo pa rin hong magpakita sa doktor. Okay? Oh, warning lang.
Agree, Doktora. Mai-add ko lang po, sa mga pasyente po na merong request from the doctor na magpa-CBC, usually, Doktora, binibigyan sila ng slip, nung paper slip,
Yes,
kung ano yung
meron.
papagawa. Oo. However, pagka binigyan po kayo, wag po kayong mahiyang magtanong. Ano tong PT, ano tong PST, ano tong ganito? Kasi under the CBC are a lot of values na pwedeng na gustong makita ng doktor. Depende kung anong specialista, tama po ba, Doktora?
Yes, depende.
Okay.
Like kidney,
So magtanong po kayo.
specific na hanap, ganon.
Yes.
Naku, Reyna, ito lang ang sasabihin ko sa iyo, sorry to tell you this. And doktor din ako. And nurse ka rin, okay? Magtanong ka, busy doctor, usually, naka na yun, sama na ng mukha, eh. Okay? People do not I'm sorry, talagang ganun, eh. Kasi we are pressed for time. And then, usually, one question will lead to another, and then another, and then another. Ganun talaga, eh. So, that's why I'm holding this free consultation. Kasi honestly, ako rin, doktor, pressed for time talaga kami. Wala kaming oras para magdalawang oras sa'yo kung ano yung nangyari sa CBC mo, no? Basta anemic ka at umalis ka na rito. Ganun lang. hindi I am not I'm not giving a fault to doctors. I am giving the reality po of practice. Yun lang. And the reason that I would like to explain it po dito is, yes, you can search for the Google. Pero kung minsan yung Google po nasa English din naman, So, better na may context siya. Ano mo yon? Ang hirap talaga, ginugoogle mo, akala mo may cancer ka na din, nahimatay ka, yung pala hindi naman. Okay? So, yun lang. Pero talaga maganda. O sige, let's move on to our next question, Miss Reams.
From another viewer on our Facebook, Doktora, bakit po nagkakatubig sa baga ang mga tao?
Actually, this happened to a cousin of mine recently. That's why pinutakti po ako ng mga pamangkin ko regarding this issue. And it's very common. Meron ho ba sa inyong nagkaroon na po? It's quite common na nagkakaroon po ng tubig sa baga. Okay? Question number 1, tubig ho ba talaga ito? Is this literally water? Okay. Yung sinasabi po nila let me type it lang po para ma-type po nila yung formal term po, no? Ita-type ko lang po para makita po ni Miss Kat how to type it. The formal term po is called a pleural effusion. Okay? Ayan, pleural effusion. Ita-type po ni Ma'am Kat yan. I just sent it to her. So, what in English po, no? Pleural effusion. In Tagalog po, it is called sa mga doktor, pag sinasabi po nila may tubig po sa baga, inyong nanay, tatay, lola, or perhaps yourself. So what's the meaning po and where does it come from? So ayan po, pleural effusion. So number 1, hindi po siya talaga tubig. Okay? It is a bodily fluid. And usually po, it is divided po based on the case into 2 kinds, the transsudative and the exudative. Naku, Diyos ko, ang hirap na. Transudate or exudates. Okay? What is the meaning po nito? And why? And where does the transudate or the exudate come from? Okay? Hindi siya tubig. Okay? Hindi siya literal na tubig. Like, it's a bodily fluid. So, let's explain the lung. Ito po yung baga natin, There's, nakabalot po siya ng what we call the pleura or the lining of the lung. Typically po, meron po talagang small amount of fluid between the viscera, the pleura. May layers po yan, okay? Now, usually the body po and the lymph nodes, they filter, nagkakaroon ng tubig and then it gets reabsorbed, nagkakaroon po ng tubig and it gets reabsorbed. Now, pag kayo po ay may sakit sa baga, there can be a time po na there's more than enough po. There's too much fluid na hindi na po siya ma-absorb. Okay? So, the most common, there are common reasons po kung bakit po nagkakaroon ng tubig sa baga. And how would, first, I'll give you a few examples po. If you are in heart failure, it's possible po that the fluid might back up po from your heart into your lungs and nagkakaroon po ng tubig sa baga caused by heart failure. One of the most common causes din po ng tubig sa baga are infections. Number one cause po talaga sa Pilipinas is tuberculosis. Ang TB po can cause an infection in the lung, and because hindi na po nag-work mabuti yung production and yung drainage, then we have what is called a tuberculous pleural effusion or a pleural effusion ng dahil po sa TB. Third most common po talaga, also pneumonia can cause pleural effusions, okay? Not only TB, but it's very common sa Pilipinas, ang pulmonya po can cause a pleural effusion. Another very common cause po talaga of pleural effusion is cancer. And that's usually caused by cancer cells po in the lung. Pag kinuha po natin yung tubig sa baga, dinala po natin sa laboratorio, we will be able to see po the cancer cells that are circulating in our lung. Two of the most common causes of pleural effusion po na cancer is lung cancer and breast cancer po na nag-spread sa lungs. So, this is like a whole hour on pleural effusion. So, short na lang. And then we'll do a whole hour on this, okay? How do we know na we have pleural effusion? Some people po, lalo na ho, kung mabilis ho, kasi the fluid can happen quickly or the fluid can happen over a short period of time, padagdag po ng padagdag. Kung medyo mabilis po yung dating po or the buildup of the pleural effusion or yung tubig sa baga, it can cause you to become very short of breath. Pero kung mabagal po yung pagdagdag ng fluid, nasasanay ho yung katawan natin, a little at a time, di natin alam, 1 litro na pala. And I have removed all liters of fluid from the lung. So, most common po talaga is shortness of breath or hirap huminga. Number 2 cause po talaga, sign is inuubo. Nakakairita po yung tubig sa pleura and it causes us in the lung and it causes us to cough. So, coughing po, nahirapan huminga. Number 3 po, yung humihiga, nakaupo na po, hindi na po makahiga. That's again because of the fluid backup po. So, those are the most common causes. Most common symptoms. Meron pong cases na wala po tayo nararamdaman. And that's usually from the buildup po of fluid. And kung konti lang po yung fluid. And sometimes we find this out nung pag nagpapa-check up tayo sa doktor, sasabihin niya, parang may tubig sa baga mo. Listening to you. And then you'll be sent po for an x-ray and then ultimately an ultrasound po. And then that's how they diagnose pleural effusion. Treatment, puntahan na lang natin yan next time since medyo mahaba na. But not to worry po. Most of the time, we treat the pleural effusion or the tubig sa baga, we treat the main cause. And yun po yung makakabawas po ng tubig sa ating baga. So, Rains, have you seen a patient or heard of tubig sa baga na in the past?
Yes, Doc. Ito po ba yung nilalagyan? Medyo matagal na ako naging nurse, no?
Yes, ito yung nilalagyan ng tubo. Yes, ito yung nilalagyan ng tubo.
Opo.
They put a test tube dito. Yes.
Nakapag-intubate na po ako, doktora, ng patient. Kami din po yung drain ng mga tubig. The nurse do the draining. And tatanungin kami ng doktor kasi hindi namin pwedeng itapon basta-basta yung
Yes,
yung
tama
bid
yun.
na drain. So we will put it on a separate bag, and then the doctor will check the fluid.
Tinitingnan kung how much ang na-drain sa araw-araw. Tama ka, that is the job of the nurse.
Kung anong
Yes,
color, anong consistency,
yes,
yan. Kung anong amoy.
ganon.
Yes,
Yeah.
inaamoy po namin yun.
Yes. No,
Yeah,
because if there's pus, that means infection yun.
yes. So, totoo po yun.
So,
Tama po yung sinasabi ni Doktora. Yun po.
yun. So, if you are a nurse, I'm sure you have experienced this sa ER, sa ICU, sa medical wards, ganoon.
Yes po.
Yes, it is drained. Hindi ko na lang pinuntahan kasi buong araw natin ito mag-uusapan.
Oo.
And just a short intro
Yes
lang.
po. And you have to have a special certification to intubate a patient. Hindi po pwede po
hindi naman
nurse lang po. Yes po. Kaya po, pag may naglalapit po sa inyong nurse para intubate po kayo, pagkatiwalaan niyo po kasi certified po yun. Hindi po kayo bibigyan ng nurse na hindi po na walang certification. Yun lang po, Doktora, on a nurse perspective.
Okay. Next.
From another viewer po, Doktora, what's the meaning of the stage 4 cancer? Magandang tanong po ito.
Ay, talaga. I am a member of Cancer Free Philippines and the Facebook group, and ito po yung isa talaga sa pinaka-common questions. And it is very difficult for me to answer kasi usually, that's why nag-iingat din ako sa pagsasagot sa internet, Reina and Katz, and to all of you. Kasi po, when someone asks that, usually somebody told them na their mommy, their lola, their daddy is stage 4 or worse, sila yung stage 4. So if you don't know and understand why they're asking the question, lalo na po sa sa internet, kuminsan baka mahimatay po yung tao pag sabihin po natin. So stage 4 is a very delicate question po. And if somebody will ask you that, siguro maybe one of the first questions that you might ask to them is, bakit po kayo nagtatanong? Meron po bang nasabihan po sa inyong pamilya o kaya po kayo na stage 4? Don't just answer kaagad the answer, guys, ha? Kasi excited kayo dahil alam niyo yung sagot. Like kami, doktor kami, sagot lang. No. Before you ask that, before you answer that, lalo na if you don't know the backgrounders, tanungin niyo muna, bakit po kayo nagtatanong? Kasi baka yun yung taong nasabihan lang kanina ng stage 4, then sabihan po natin straight out, mahimatay po yun. Okay? So what is stage 4 and why are there stages po of cancer? This is a very, very nice and sensitive topic to everyone. Kasi everyone rin naman, meron tayong elderly relatives or what, na nabigyan po ng diagnosis na ganito. And I would like to tell you guys, mabigat po ito. Okay? Mabigat po. So why do we stage cancer and why is there cancer staging? Cancer staging is usually done po to have prognosis. And what is prognosis? Prognosis, anong mangyayari po? Which is everyone's favorite question. Doc, ilang taon ho ba? Or doc, ano ba? So we stage cancer so that we know kung nasaan na tayo. Are we early or are we late? So what is the meaning of early? Early means hindi pa po kumalat yung cancer from the point of origin. Like for example, if you have a breast cancer po, dun lang po siya talaga. Or if you have a colon cancer, dun lang po siya talaga. Meron pa nga akong stage 0, yung hindi pa ako nakapag-transform. Okay, so that's stage 1. And it goes on po, it becomes more and more serious from stage 2, stage 3, and finally stage 4. How do we know the staging? Every cancer po has different staging. Iba po yung staging ng breast, iba po yung staging ng colon, iba po yung staging ng lung, iba po yung staging ng prostate. Okay? So lahat po yan, they have to be evaluated based on the kind of cancer that they are. And then sometimes it's also based po on the spread, gaano kalaki po yung mass or yung tumor, natanggal ho ba lahat? Saan na po kumalat, which lymph nodes. Based on where the lymph nodes are, this is the staging of lung. Based po kung the lymph nodes around the lung or dito na rin ho, around the neck, malalaman po natin between stages. And then, what is stage 4? Stage 4 po is the stage po na talagang kumalat na po outside of the organ yung ating cancer. What's the meaning? So, stage 4 is metastatic disease or kalat na po. Okay? What's the meaning of, for example, breast cancer? Puntahan natin. One of the most common. What is the meaning of stage 4 po in breast cancer? Stage 4 means na the cancer left the breast na po. And it went not only to the lymph nodes, but to other parts of the body. This could be the liver, this could be the lung, this could be the brain, the most common po. So when we say po that it is breast cancer primary metastatic to the lung, that is already stage 4 with metastasis to the lung. Sa Tagalog po, meron po kayong cancer sa breast or cancer sa suso na kumalat na po at pumunta po sa baga. So you do not have two cancers. You have a primary cancer and a metastatic site. Okay? So yun po yung stage 4 and that is why it is very sensitive. Kasi po, ang stage 4, the prognosis talaga for stage 4, wala na po talagang cure. And people cannot accept that. They will really break down crying. Wala na po ba talagang magawa. Well, what I could say po, for stage 4 cancer, we cannot take it out of your body anymore. Nandun na po siya, kumalat na po siya. But again, with proper treatment, pwede po nating makontrol hanggang doon na lang po. And hopefully, we could still prolong your life. So, if someone will ask you po, what is stage 4? Do not immediately volunteer. Yun ho yung kumalat na ho sa katawan. Please be sensitive muna. Find out muna what's the context. Ano po yung backgrounders po ng tao at bakit po nila natanong yon. And once you answer that, then please be sensitive and alamin ho muna natin lahat kasi nakaka-shock din po. But for those who asked, that is the meaning of stage 4. Okay? So, Rains, anything about, tama ba yung sinabi ko na don't just blast out?
Tama po kayo. Actually, may add ko lang, Doktora, even kaming mga nurse, hindi kami pwedeng mag-discuss regarding staging of cancer. Bawal po kaming mag-discuss. Ang lagi po namin sinasabi, ma'am, pakiintayin niyo po si doctor, siya po mag-explain. Bawal na bawal po kami mag-give out ng information regarding anong mangyayari sa inyo, ano yung stage, ano ba yung yung pwede niyong maramdaman. Kahit alam po namin clinically and medically, bawal po kaming mag-divulge ng information. Kahit po sa kamag-anak, bawal po. Only doctors can. Opo.
Yep. Tama yun because it's sensitive. Pero you know guys, should persons tell other persons that they are stage 4? Ako, my answer to that sensitive question is yes. Especially po kung tinanong ako mismo ng pasyente. Kasi pag ako po ay tinanong, these relatives tell me, Doktora, please don't tell mommy she's stage 4 kasi po mawawala na po siya ng hope. Kaya lang, what am I going to tell someone when she tells me, an intelligent woman who's like 80 years old, maybe a doctor also, or a professional, or someone who really knows, or just someone who's in touch with herself. It's just, Doktora, tapatin mo ako. Ano stage ako? Then that's the time to be honest. So that's what I tell relatives also. If your mom or your dad asks me straight out, I have to answer the question. Kasi,
and Doktora, di ba legal binded po yun na kailangan you have, if the,
but
that's the,
I'm also, tama ka doon.
It's a patient's right, di ba po? Pag nagtanong, sila na ang nagtanong at hiningi nila information, kailangan po ibibigay niyo po. Tama po ba?
Yes, it is you are legally mandated talaga to tell patients what they have. But you know, I'm also working in the Philippines and I'm also sensitive to Philippine culture. So if I know something, I will really tell the relatives, you know, you have requested me not to tell your mom, dad, sister, whatever. But if she asks me, I have no choice. Yun. So, okay, guys.
Doktora, question. But if the other question other way around, like say, for example, the patient naman requested not to tell any of the support group or any of the relatives, diba we have to give into that request?
Yes, the patient. The patient is your personal. Siya yung may obligasyon ka sa kanya. Wala kang obligasyon sa tatay niya, sa nanay niya, sa asawa niya, or what. Your relationship is with the patient. So if the patient doesn't want to tell, wala tayong magagawa. Pero again, I do not like lying to people. Okay? I
Mhm.
really don't. Especially, so, you know what, sa mga close kamag-anaks and even close patients to me, I'll tell them, ma'am, stage 4 na po kayo. Nahihirapan na po kayo sa inyong sakit. Ngayon po, we've had this journey for what, 3 years, 4 years. I know you so close. You're like my mommy or my tita. I will have to advise you po to tell A, your children, B, your brothers and your sisters para makapaghanda rin po sila. Ngayon, I don't know your personal life kasi hindi naman ako ang judge noon, ano. But I will really tell people that it's time to reveal po what's happening para maka-adjust din po yung pamilya. Kasi if they don't know naman that you're stage 4 and then they're demanding that you run the family business or ikaw yung mag-host ng kanilang Christmas and New Year tapos honestly hindi mo na talaga kaya. May mga family obligations na ganyan Rina. I really want people to open up also. Sabi nila, Doktora, I don't want to scare them. Sabi ko, we're not scaring anyone. We just really need to open up na talaga and be honest kasi nandito na po tayo. Yun lang. There will be a time na I'll really tell you, nandito na po tayo and we really have to be honest po. Yun.
From
So,
Miss
medyo,
Beth Taro.
o
Yeah.
sige, Ma'am
Hello
Beth.
po, Doc. Cancer survivor din po ako. 13 years na po. Till now, buhay pa. Thanks to God.
Thanks, Ma'am Beth, and hoping po that you will have many, many more years pa po of health with your family. Thank you so much po.
Okay, next po question. From another viewer, Doktora, may punta sa bahay namin. May pumunta sa bahay namin from health office daw po. Mga scammers kaya po yun. I'm scared.
This also happened to one of my patients. That's why I'm bringing it up. At first I thought it was a scam Pero, Reina, people can come to your house. These people might be the contact tracers. So, ang advice ko po talaga sa mga tao, if someone comes to your house, please don't open the door muna. Kasi syempre, safety rin naman, ano po. Demand po IDs and then call up po the office or your barangay. And clarify po talaga kung sino po itong mga pumupunta. Kasi alam po natin may mga budol-budol po ngayon. And praying po rin on the fears of persons. Kaya lang, meron pong situations po talaga ngayon na for example, hindi mo naman alam rin na sa office mo pala merong nag-positive. And then, of course, you were identified as a close contact and the contact tracers have to come to your house. And then, maka-quarantine po kayo if you are a close contact po of a positive person. So, that may happen in your office. Another possibility na, do usually nag-uupusap naman yung magkaka-opisina, no? Another place that could occur is if you attended po, and this is very common ngayon, narinig naman po natin, no? If you attended a gathering na may nag-positive po, because it is a gathering or a party, hindi po nalang ma-determine who sat next to whom. So if you are the caterer, the waiter, the guest, masasama ka talaga nun sa close contact mong positive na sa party kahit malayo ka doon. Kasi di naman natin alam kung saan umikot yung tao. Another possible reason po for a contact tracer to knock on your house is halimbawa po you just arrived from abroad and then somebody was positive on the plane even though you and na pick up po. So even though if you were already tested PCR negative po pagkadating nyo, the fact that someone was positive on your plane, parang ma-activate po lahat 'yon and they need to talk to you. So these are reasons po that a contact tracer might knock on your door. So, ang advice ko talaga sa ganito, please don't open your door immediately kasi baka naman hindi po talaga 'yon. Kunin niyo po yung mga ID ng mga tao. Please call the barangay and you can call naman po the city and the province health department and investigate po kung totoo. Kasi I cannot naman tell you to open the door lang naman kung ganun sa province usually ang kasama po nito is the barangay captain. So makakapag-usap po kayo ng maigi with that. So normally I would say it would be a scam pero ngayon hong panahon ng COVID, you might have have for example, you rode a Grab car, okay? And then the Grab car driver was tested positive. So syempre ililista po niya lahat and alam naman po nila kasi you booked it through the app, 'di ba? So alam po nila kung sino po yung mga sumakay ng mga 5 araw na yon na positive po si kuya. So matatawag po talaga kayo sa ganun. But again, please don't open the door and i-verify niyo po muna. Okay? Kasi for your safety din po yan.
All right, next question please. From Mizari Larin, halimbawa po, kailangan pong manatili sa ospital para sa operasyon na gagawin. Ano ang mga dapat gawin o tandaan ngayon pong pandemya?
I guess Zari is asking questions about COVID safety for those po na operahan. Tama ba ako, Zari? Ako po,
Mukhang
I'm
ganun po.
telling, parang that's the way I interpret the question. Tama ba ako?
Yes po, ganun ko din
Yeah.
po siya naintindihan.
Yes. Okay, this is my advice. And ako po, I just wanted to reveal na napunta rin po ako sa ER twice for a family member. And then I've also had family members po na naoperahan during this COVID times. Ako mismo naoperahan, pero minor lang ho, don't worry, during this COVID times. So, i-walk through ko na lang po kayo sa naging experience ko po at naging experience po ng mga pasyente ko. Okay? Let's assume po that the OR po is not an emergency. Kasi kung nabundol ho kayo ng tao, then ng sasakyan, ibang issue yun. Sabihin na lang po natin na semi-emergency. Let's say magpapabiopsy po kayo or na appendicitis, which in itself is an emergency. So if it's, first of all talaga ngayon, kung hindi naman ho kailangan gawin yung surgery, the surgeon will tell you na it's elective, you can wait naman. Pero kung semi-elective, like mga cataract, hindi ka na makakita, mga lus-lus po na may problema na or ganun po, a few days before your isi-schedule po yung OR nyo. And a few days before your OR po, you will be asked to take a swab test or a PCR test. Just to make sure na kayo po, hindi nyo po, that you are negative. So, assuming po na negative po, i-check in naman po kayo sa ospital. Please don't worry, most of the patients in the hospital po are swabbed. So, talagang maingat din po sila. And our nurses, our medtechs, lahat po yan talaga naka-mask and naka-face shield. And they are not allowed to remove that at any point po in the hospital. So, talaga nag-iingat po sila. Ang advice ko po sa inyo, after your swab, mako-confine na po kayo sa hospital, don't panic kasi more or less safe. I cannot tell you that it's 100% safe, but what I can tell you po is that they are really trying their best, okay? Pero in terms of visitors, and magbabantay, kung kayo po ay maoperahan, ang advice ko po sa inyo, isang bantay na lang po. Our culture, nagiging 10 pa ang bantay, lalo na yung malalaking pamilya. But in this day and age po, lalo na ngayon, do not bring your entire family to the hospital. In fact, I would advise one bantay and to limit visitors. In fact, kung ako ang tatanungin, wag na kayong magpabisita. Okay? It's for their safety and for your safety rin po. One bantay is more than enough. And si one bantay na yun, bigyan nyo po rin po ng mask and face shield. And yun lang po. After your OR, you're probably okay to go home, and I hope po that you will be safe and sound. Okay?
From another viewer po
At
natin.
Irena, before we go to the next question, one of the things I'd like to stress is limit the bantays and the visitors. Please, I know it's in the Filipino custom, but magpadala na lang kayo na regalo ngayon, okay guys? Huwag na po kayong mismong pumunta. Lalo na if you are in the vulnerable age. And even if you are not in the vulnerable age, please don't go na lang. Magpadala na lang kayo ng mga text and maybe gifts, okay? Or pagkain. Ikaw, Reyna.
From another viewer, bakit po COVID na lang ang pinag-uusapan? Nakakasawa na po talaga.
Talagang pandemya eh. Though, if you notice, we are moving away from COVID topics. But, the COVID vaccine is a hot topic na yun eh. We are going to go there din po. I'm just trying to gather information. Right now po, they're trying to educate the doctors eh. Pero I think we need to educate the general public. So, ganito na lang po. Let's have a mix of questions, both COVID and non-COVID. Kasi tama naman po yung tanong ng tao eh. Hindi lang naman COVID ang sakit ng madlang tao eh. People were dying long before this COVID arrived, okay? Of cancer, heart disease, disease, lahat. Lahat po yan importante din.
From Mr. Jimmy Fariaga, good morning, Doktora. Ano po dapat gawin? Mababa po ang WBC ko. Nung nagpa-CBC ako kahapon, ano kaya dahilan ng pagbaba ng WBC ko? Thank you po, Doktora.
Sobrang baba ba? I would think small variations is not bad. And kung minor lang naman po talaga, I would just recommend repeating po the CBC. Ngayon, kung talagang wala na kayong WBC, that's another issue po talaga. Another question that we would, this is a question for tomorrow eh. Another reason po that I don't, this is why we need to see have history and PE eh. Kasi people on chemotherapy po can be what we call, leukopenic. Mababa ang WBC. So we need to look into that. Kung hindi naman po nagpapakimo yung isang tao and ano lang po talaga, just minor, paulit yun na lang. Ayun po. And then of course, consult your doctor.
From Mr. Bungay Mariano Nuki, Doktora, tatanong ko lang po, bakit po pag gumigising po ako sa umaga, nagugulat po ako tapos po, kabilis po ng pintig ng puso ko po, Doktora.
Ang mabilis ang pintig ng puso niya when he wakes up? Ganun ba? Pakiklaro lang po ulit.
Doktora, tanong ko lang po, bakit daw po pag gumigising po ako sa umaga, nagugulat po ako tapos po, mabilis po ang pintig ng puso ko?
Have you timed your heartbeat? I don't want to comment on this muna eh. Kunin niyo po talaga what is your actual pulse rate. And then number 2 po, tingnan niyo po kung pantay po yung, is it going bug, or variable rhythm po. And then, it's hard to answer this question eh. Opo. Advice ko talaga is, monitor po yung inyong heart rate, and then monitor po kung even po yung inyong heart rate. Another reason that you might consider po is, are you drinking a lot of coffee? Yan po. Or energy drinks. Kung talaga pong you are prone to fast heart rate or tachycardia, you might consider po reducing the amount of coffee that you drink or the amount of energy drinks that you drink. Opo. Kung talagang mabilis po, please like 120, go to the doctor po and have an EKG taken po. Okay? And then we will move on from there.
From Ms. Rosavilla Tenoso, Doktora, ask ko lang po, palagi sumasakit ang sikmura ng asawa ko. Okay na po ba yung pinainom ko ng pantoprazole 40 milligrams?
Ma'am, it's okay for the first month. Pero kung hindi po nawawala, you might need to have a further investigation po ni sir. Kasi we cannot let that go kung talagang matagal na po. Okay?
From Ms. Ping Fabricante, good morning, Doc. Pwede po ba mag-take ng vitamin for lungs? If yes, ano pong brand ang effective? Thanks, Doc, and God bless.
Vitamins for the lungs. Wala naman po talagang vitamina specifically for the lungs. But one multivitamin a day is okay po for general health. If you are eating healthy, medyo okay na po yun eh. But if you want to take one multivitamin, it is okay. I don't really give brands po, pero marami naman pong kilalang brands na disente. You can choose one of them. Okay? At yung abot kaya niyo po.
From Ms. Doris Jing Dizon Gaviola, hello po, Doc. Cancer survivor po ako, 20 years na. Stage 2 yung sa akin. Thank God.
Yes, ma'am. I'm happy for that. Thank you rin po.
From Ms. Vax Flores, Doktora, ano po ang gamot kung may bato ka po sa bato? At may stage po ba ito? Salamat po.
Ang gamot dyan, Dr. Dodge. Ma'am, we have a video po on bato sa bato. Ang ganda po ng usapan namin. Kapampangan din po yung doctor from Candaba. si Dr. Dodge Limhoco. He really did a good job on this. Short answer na lang po, no? Kung talaga pong may bato po kayo sa bato, there are medicines for this. Pwede rin hong ma-dissolve using lithotripsy, yung shockwave. And kung prone lang ho naman kayo to form bato sa bato, the number one talaga is to increase po talaga yung inyo pong keep on drinking water, ma'am. That can help a lot.
From Laging Taguko, Doc, my mama died of colon cancer. I'm scared kasi when I poops this morning, may fresh blood po. Nafe-feel ko po ang hapdi ng aking anus po.
How old are you, ma'am? Usually, ma'am, male relatives ng colon cancer eh. Like if your dad. But kung may dugo po kayo, I would definitely suggest having a checkup, especially with a family history po. It may only be hemorrhoids, but again, it's better to check. Again, I have a really fabulous video neto po with Dr. Atenedoro June Ruiz Jr., a gastroenterologist. Ma'am, March po is Colon Cancer Awareness Month. My advice to you, ma'am, magpatingin ka sa GI. Patingin ka. And again, don't panic ha. Kasi it could just be hemorrhoids, but it is better to know. Huwag niyo pong pabayaan.
From Mizari Cruz Larry, magandang tanghali po. Marami nga pong budol-budol ngayon, lalo na po sa barangay namin. Yun nga pong nagtitinda sa amin sa may kanto, nag-ingay lang po, nagtawag kaya, dali-dali pong umalis yung mga nagbubudol. Nung bumaba po ang may mga kasama niya sa bahay.
Yes, ma'am, kasi ano nga there are reasons that the contact tracers would go to your house. Pero some people or some persons are using this, para naman humanloko. So before you open the door, ma'am, hingan niyo po muna ng ID yung mga tao. Tumawag po muna kayo sa barangay captain and do not let anyone in po unless you verify po yung kanilang identity.
From Revelation, Catan. Hi, Doktora. May I ask if there's any difference sa sipon ng COVID and just allergies? Thanks.
Ma'am, yun po talaga yung mahirap po ngayong panahon na ngayon. The symptoms of COVID really are very, what we call po sa medicine po, what we call is non-specific. In other words, it could be allergies, it could just be a plain cold, it could be pneumonia, it could be the flu, it could be TB, or it could be COVID. So talagang mahirap. But one specific, pag nagsama-sama na po yung constellation of symptoms, fever, wala ng panlasa and pang-amoy, there's a high suspicion po talaga of COVID. And again, yung where did you go? Yan po talaga. Yon. Kung may exposure po kayong alam natin. But yun po yung difficulty talaga eh. And in this day and age, ma'am, if you present talaga na, halimbawa, inuubo, nalagnat, masaswab talaga kayo, ma'am.
From Mr. Inot Jo, good noon po, Doktora. Pag mabaho na talaga ang ilong natin dahil sa sipon, kailangan ba talaga operahan o may mga gamot lang na kailangan inumin? Salamat po.
I'm sorry, I didn't get the question. Pakiulit lang po. And the light is shining on the phone. I cannot read it. Opo.
Good noon po, Doktora. Pag mabaho na talaga ang ilong natin dahil sa sipon, kailangan ba talaga operahan o may mga gamot lang na kailangan inumin? Salamat po. Hindi ko rin masyadong...
Mabaho ang...
ilong. Mabaho na daw po yung ilong dahil sa sipon.
Sir, as far as I know, no, hindi po, are you talking about nasopharyngeal carcinoma? Like cancer po behind the nose? Kasi bumabaho po yun. As far as I know, wala naman hong inooperahan because of sipon. Give me more details po na malinaw. Though there is what we call nasopharyngeal cancer, it is located po, dito po, no? Here, behind our nose. That is operable. And ang it's either radiation or operation. Opo. I did not understand the question. I'm sorry po. Pero
From,
wala naman hong inooperahan sa sipon. Opo, wala po.
from Mizari Cruz Larin. Halimbawa po, kung nakauwi na po mula sa pagkaka-ospital, ano naman po ang mga dapat gawin o tandaan sa bahay?
Mama, eto lang some people, like if their relatives got home from the hospital, would demand po a 14-day quarantine. Kasi nininervyos sila, lalo na kung merong mga vulnerable age sa bahay. Hindi naman po masama yun. You can put the sick person in the room. Huwag mo na kong palabasin for 10 days. Pwede rin po. Other people naman po are comfortable naman po na alagaan na lang po sa bahay. May sakit kahit nanggaling sa ospital. Whichever you would choose, wala naman pong masama doon. If you want to quarantine your relative, wala pong masama doon. If you want naman po na hindi rin, wala rin pong masama doon. It's a matter of comfort.
From Miss Marianne F.A. Mabuti. Hello po, Doktora. Hope all is well. Thanks for your guidance sa mga tulad naming patient na worry sa aming kalagayan. Can you please discuss on the tubig sa puso at dystolic dysfunction? God bless po.
Ano pong dysfunction, ma'am? I'm sorry, napuputol-putol po.
Dystolic dysfunction po at tubig sa puso.
Dyscolic? Baka systolic.
Dystolic.
Diastolic dysfunction.
Diastolic dysfunction.
Ba? Hindi, diastolic yan. And tubig sa puso. Ma'am, this is best addressed by a cardiologist, okay? Kasi medyo malalim-lalim po ito. But just short lang from a general internist. Ang diastolic dysfunction po, that's usually measured po by, di ba we have a BP? Like 100, 120 over 80. Pag tumataas po yung lower number natin, nagiging 90 to 95. People usually, and cardiologists usually say, that's what we call diastolic dysfunction. D-I-A-S-T-O-L-I-C. Ano ko, para maano. Wait lang diastolic dysfunction. Ayan. Wait lang po. Sorry, I'm just typing it po so that they can type it into the Ayan po. Okay. So usually it's the lower number po, no? 120 over 80. The lower number po. That is usually which tells us the relaxation of our heart during diastole. Just ko, hirap. Nagets niyo yun? How do I explain this to Okay, ganito. During systole. Okay, Diyos ko. So now we have to go into systole and diastole. Okay. Yan, that's the type that It's a cardiologic term used by cardiologists. Okay, there are two stages. Ano ba to? Yung heart natin po goes into systole and diastole. Okay? Systole po means yung pag the pumping action of the heart moving forward. Ngayon, as the heart, and then there comes the point po of diastole. That's the time that the heart is filling with blood para may ipapump siya uli palabas. Okay? So for your heart to fill, your heart muscle must relax para lalaki para mapuno uli yung dugo ninyo. Ngayon, yung tinatawag po nilang diastolic function, because our heart is not working so well po, and probably also due to cardiac disease, persistent high blood pressure, hindi po makarelax yung mga chambers po ng ating puso. So it is stiff. Ganon. It is stiff. And that is what we call diastolic dysfunction. At masama rin po yan kasi hindi siya maka-feel ng mabuti. So if there is any cardiologist listening here, I hope that it's correct. And for those lay persons listening here, I don't know if you got it, pero medyo mahirap pong ano yun. But basically, it's the inability of the heart chambers to relax so that the filling of the heart can occur during diastole. Just ang hirap, no? It's not really that easy to to translate science, but I hope so. How do we treat diastolic dysfunction? Malalim na to eh. We treat diastolic dysfunction through various pharmaceutical drugs, one of which po is to relax the heart, usually calcium channel blockers, and the other one is to prolong diastole. So, para ho, to give more feeling time to the heart. Ah, sorry. Iyon. Reyna, na-gets ba yon? Medyo malalim. Mom, I'm sorry. Let me find a cardiologist to do this. But basically, ma'am, malalim po talaga yung tanong. It's not easy to understand. It's not easy to answer. Okay? But basically, diastolic dysfunction is the inability of the heart to relax and to be properly filled during diastole. Okay?
From Mizari Cruz, Larine, mapang po bang pagkakaroon ng
question lang. Sandali lang, ako lang muna, please. Question, are there a lot of questions pa para I know whether to answer slowly or quickly?
We have like 2 na lang po, Doktora. All from Miss Zari. Both are from Mizari Cruz, Larine.
Okay. Okay. Apa. Okay.
From Mizari Cruz, Larine, mapanganib po ba ang pagkakaroon ng cyst sa dibdib, suso ng isang lalaki o babae?
Cysts. Most cysts po are in females. I haven't really heard a lot of cysts in males. Opo. Cysts are non-cancerous in themselves. So it's not really that dangerous. They usually comes and go po with menstrual cycle. Ang masama po is if that we discuss, cyst lang yan, yung pala cancer na. Yung mga ayaw mo magpa-doktor kasi narinig mo maraming taong may cysts. So if you do suspect that you have a cyst, just make sure it's really a cyst. Okay? Yun lang po. But if it's really a cyst, don't worry, wala pong problema yun. Minomonitor lang po yun.
From Mizari Cruz, Larine, marami po sa panahon ngayon ang umuubo o matagal na ang may ubo. Nakakatakot po. Ang iba sasabihin baka may COVID ka. Ano po ang gamot at dapat inumin? She's talking about coughing, Doc. Prolonged coughing.
Ma'am Ziari, again, another good topic po in the letter C, coughing. There's a workup po talaga for cough. There are many reasons po for cough. I'll just run through them quickly. Number 1, of course, the infection. Number 2 po, asthma. Number 3 po, allergies. Number 4 po, gastroesophageal reflux. And number 5 po, it might be an early sign po of cancer. So if you have been coughing for a really long time, hindi po pwedeng pabayaan. You need to undergo po with a pulmonologist or an internist what we call po a cough workup. That includes po trials po ng iba't ibang gamot, and kung talaga pong hindi mawawala, there's also pala, I forgot to mention, there is a cough po associated. It can be a side effect of some, not many, but some gamots, prescription gamots. So may workup po yan that includes trial of gamots, evaluation of present gamots. And number 3, kung hindi po talaga gumaling, then kailangan po ng mga further workups that include CT scan and possibly endoscopy. So yes, it is worrying po talaga to have a chronic cough. Kasi po, sa mga panahon ngayon, if you keep coughing, pwede ho kayong pagkamala ng may COVID. Pero ito naman ho, if you have been coughing for more than 14 days, 14 days ang sakit ng COVID most of it. So, kung talaga more than 14 days, hindi na po yun COVID. Okay? Yun naman yung good news.
Doctora,
so, is that it? Do we have a last question?
Yes po.
Okay, guys. So, thank you so much for joining us. It's already lunchtime. And thank you for your patience. Thank you, Reina. And thank you, Miss Kat. And tomorrow po, around 11 o'clock, let's discuss the complete blood count. Okay? Maraming salamat po.